So this is the part 2 of thyroid gland anatomy. I'll be showing you how to draw the thyroid gland and structures, the arterial supply, venous supply, the lymphatic drainage, and the nerves. So first we'll draw the hyoid bone. So that's how a hyoid bone would look. Then we will draw the thyroid cartilage. So that's how the thyroid cartilage would look. And this next is the cricoid cartilage. So this would be the thyroid membrane. You can draw some lines over here. Now remember, this is only a symbolic diagram. I'm using the touch screen to draw. Next, you have the tracheal rings. That's the second. That's third, fourth, fifth, sixth, and seventh. So we have the hyoid bone, thyroid membrane, thyroid cartilage, cricothyroid muscle and ligament, cricoid cartilage, and tracheal ring. So now I'm going to position the thyroid gland over this structure. So I told you the isthmus begins from the second to the fourth tracheal ring. So I'm going to draw two markers over there. That's a second, sorry. This is a second tracheal ring. And this is a fourth tracheal ring. Now from here, the lateral lobes come up to the thyroid cartilage on the top and the sixth tracheal ring below. So I'm drawing on the side and going below up to the sixth tracheal ring and joining back over there. Similarly on this side, I'm going up to the thyroid cartilage. So that's how it looks like. Now, if you want, you can add a pyramid lobe like this if you are intending to show that. So right now we don't need it now. So we have that much. Then if you want to color the thyroid gland, you can show. You can just color it so that in real we'll be having the option to draw it on paper with pencil. This is how it would look like. So that's a thyroid gland. We can extend this a little bit over here. Okay. So drawn the thyroid gland. So we have the hyoid bone, the thyroid membrane, the thyroid cartilage, cricothyroid ligament and cartilage, cricothyroid and the cricothyroid muscle and ligament, Then we have the cricoid cartilage, tracheal rings, and the thyroid ring. This is one anatomy. Once you learn to draw this, you can use it in all the diagrams for the diagrams related to the anatomy. So now here we'll draw the first part is the arterial supply. So for that we need the arch of the aorta first. So that's the arch of aorta. Then we need the left subclavian artery. So that goes that side. Then you have the left common carotid that goes all the way up. And from here it divides into external and internal. Similarly over here we have the right brachiocephalic trunk. And from there you have the right common carotid which divides into external and internal. And here you have the right subclavian. Okay. So from here, now we have the superior thyroid artery coming from the external carotid artery. Similarly, from this side also you have the superior thyroid artery coming from the external carotid. Now from here, in the left subclavian, you have a thyrocervical trunk going up, which divides into its branches, of which one is the inferior thyroid artery. So that goes behind the common carotid and supplies the thyroid gland there. Similarly, from the right side, you will draw the thyrocervical trunk going like this, and again behind it is coming here. Okay. And the same diagram we can put it on this, around this. So I'm going to draw the arch over there. That's the left common carotid going all the way up, dividing into two parts. And then you have the left subclavian over here. That is dividing the thyrocervical trunk. I'll draw only on one side so you can understand. And that gives the inferior thyroid artery going like that. Similarly, from here you have the superior thyroid artery going like that. Okay. I hope that is clear. Similarly, on the right side, you will draw the arch below it, the right brachiocephalic trunk, and dividing into right common. Now remember, both the common carotids will be just lateral to the gland. So I'm going to erase this. I'm going to leave that artery there for now. I'll just remove it for now. Okay. So second one is the venous supply. So venous supply is the, you can see, you draw the two left and right innominate veins joining to form the superior vena cava. Now the innominate vein is formed by the left internal jugular and the left subclavian, that is the left side. The right side is formed by the right internal jugular and the right subclavian. Now for the record, just for your information, I'm telling the external jugular comes lateral to it, like this, directly to the subclavian vein. Okay. So this is the left and right internal jugular joining with the corresponding subclavian forming that. So the superior thyroid vein drains into the internal jugular, middle thyroid vein drains into the internal jugular, and the inferior thyroid veins drain into the brachiocephalic vein. Similarly, from the opposite side, you have this like that. Okay. And here again, you have to put this diagram over here. So we'll draw the, you have to draw the, I'll draw the innominate on one side being formed by the internal jugular and the subclavian. Now here for the record, I'll tell you, the internal jugular will be drawn lateral to the common carotid. So we have again the superior thyroid vein going down. Now middle thyroid vein goes unaccompanied. And from the brachiocephalic vein, we have the inferior thyroid vein. So that's how it looks like. Similarly, draw the opposite side. And you can color it with blue for vein and red for artery. Okay. Now the third aspect is the lymphatic drainage. Now we are going to draw the lymphatic drainage on this previously made structure. These are the prelaryngeal nodes. These are the pretracheal nodes. These will be the paratracheal nodes. Then we have the upper jugular nodes and lower jugular nodes. So from the thyroid gland, it drains into the prelaryngeal nodes. So from the thyroid gland, it drains to the prelaryngeal nodes. From the prelaryngeal nodes, it drains to the upper jugular, and from the upper jugular to the lower jugular. Similarly, you can also drain from the prelaryngeal nodes. It can drain downwards into the paratracheal and pretracheal nodes. And from there, they both can drain into the lower jugular nodes. Similarly, from the rest of the gland, it drains directly to the pretracheal and paratracheal nodes, and from there to the lower jugular nodes. So that is the lymphatic drainage. So next, I'll show you the how to draw the nerve in relation to this same structure. So now the same structure is there. So we'll show the vagus nerve on either side. This is the vagus nerve. So on either side. So from the vagus nerve, it gives rise to superior laryngeal nerve on the top, which divides into the internal laryngeal there, going through the thyroid membrane, and the external laryngeal going down along with the superior thyroid artery. Similarly, on this side, you have the superior laryngeal nerve dividing the internal laryngeal and the external laryngeal branch. Inferiorly, you have on the left side, the left recurrent laryngeal nerve hooks and goes along the tracheoesophageal groove. Similarly, on the right side also, it hooks and goes along the tracheoesophageal groove. Now here the point to note on drawing inferiorly is that you have to draw the arch of aorta and the right subclavian branch on the right side. Arch of aorta showing on the left side. So on the left side, the left recurrent laryngeal nerve actually goes anterior to the arch of aorta, and once it goes inferior to it, it gives the recurrent laryngeal nerve branch, and that hooks and goes behind the arch of aorta to go into the left tracheoesophageal groove. On the right side, slightly higher up compared to the left side, the right brachiocephalic trunk giving to the right common carotid and right subclavian. Around there, once the vagus nerve crosses it and goes inferior to it, again, it gives a right recurrent laryngeal nerve branch, which hooks behind the subclavian or the right brachiocephalic trunk and goes into the right tracheoesophageal groove. So it is shown like that. In this diagram, unfortunately, the arch of aorta is not shown due to the limitation of space by the screen of the laptop. So that is about the relation of the nerve. So today I've shown you briefly. So the beauty of the diagram will be on pencil and paper. So I've shown you the structures, that is the hyoid bone, the thyroid cartilage, the cricoid cartilage, tracheal rings, thyroid gland. On that, you can put the arterial supply as the arch of aorta with the subclavian common carotid, similarly on the right and left side. Similarly, the venous supply, the innominate vein being formed by the internal jugular and the subclavian vein. And that can be put on a separate diagram on the same structure. And the laryngeal node, I already showed you the lymphatic drainage. And the fourth one is the relation of the nerves to the same structure. Now, point to remember here is that common carotid is just lateral to the gland, and the internal jugular will be shown lateral to that, and the nerve would be lateral to the common carotid. So you don't have to draw a single diagram showing all. You can draw it as separate diagrams to show a particular anatomy. So saying this, I thank you. I hope it is clear.